Hi, my name is Mary Hammonds, and I will be administering a tube feeding today. First, I will verify medical orders. I will gather my equipment. I will perform hand hygiene, identify my patient. I will assemble my equipment together and perform an abdominal assessment just to check for like distension or anything along those lines. Then I will position my patient, the head of the bed, to at least a 30-degree angle, and then I will put on gloves and I will need to verify tube placement. You can verify tube placement several ways, by X-ray, checking the pH level of the aspirate. You can measure the exposed length, and so once I check for placement, then I will aspirate all gastric contents. Um, from there, if it's an intermittent feeding, I will check the residual prior to each feeding. If it's a continuous feeding, I will check the residual every 8 hours or according to my facility protocol. Then I will flush the tube with 30 milliliters of sterile water. I will remove my gloves, perform hand hygiene, and then I will put on new gloves again, and I would administer my feeding. There are two types of feeding systems. There's an open feeding system, and with that, I will label the bag and tubing. I will check the formula type, the administration method, time and date that it was prepared, and the time and date that it will be hung. And I will also put on the tubing system as well as the bag that it's only for enteral feeding only, not for IV. Then I will hang the bag on the pole at least 12 inches above the stomach. I will clamp my tubing, prepare my feeding setup, check the expiration date, cleanse the top of the feeding container prior to opening. I will pour into the tube feeding, prime the tubing, clamp the tubing, attach the feeding setup to the feeding tube. Then I would connect my feeding pump. I would set it at the prescribed rate by the doctor's orders, unclamp the tubing. Then I will flush again with 30 milliliters of sterile water. Um, then I will clamp my tubing again, and I will disconnect the feeding setup from the tubing. Maintain my patient's upright position for at least an hour after feeding to prevent aspiration. Now for a closed feeding system, I will check the expiration date, label the bags of the tubing again, spike container with compatible tubing, prime the tubing, connect the tubing to the feeding system, connect the tubing through the feeding pump, and set the prescribed rate again as well by the doctor's orders. Then I would disconnect the feeding setup from the feeding tube, flush with 30 milliliters of sterile water again as well, and document my procedure and perform hand hygiene. Thank you.